50-year-old Ward Chesky follows up routinely with his oncologist Heidi McKean after being diagnosed with rectal cancer in 2023. Luckily, it was caught early. He went in for his annual exam and his doctor recommended he get a colonoscopy. After putting it off for a few months, he finally scheduled the procedure.
You don't know if you have something lurking unless you get a colonoscopy. We looked, and inside his colon he had a growth that was, by the naked eye, by the endoscope, consistent with a cancer. We biopsied it, and we confirmed it had a cancer.
Very shocking. You just think you're invincible. Nothing's going to happen, and it is a huge eye-opener and life-changing.
He then traveled from Pierre to Sioux Falls to meet with Dr. McKean.
Thankfully, Ward's case was caught early because he went in for his screening colonoscopy. That's the best way to find these types of situations, is you want to find a cancer early so that you can intervene and go for a cure with treatment. And so his was found where it was just localized to the rectal area. It had not spread throughout the body.
Ward was able to move forward with chemotherapy and radiation.
So that was about 6 weeks of taking chemo pills and radiation. And then we put him through 4 more months of IV chemotherapy, where he was coming in every 2 weeks to get chemotherapy through the IV. And so if you add all of that treatment time together, that's, over 6 months of treatment.
He was also enrolled in a clinical trial.
The trial is actually looking at how can we make total neoadjuvant treatment of rectal cancer even better. And so everybody does start out with that long course chemoradiation where we treat with chemo pills and radiation for about 6 weeks. And then the randomization is that some patients do the 2-drug IV chemotherapy, or some patients even get access to a 3rd drug added to that. So it's even more aggressive IV chemotherapy.
After the rigorous treatment, it was time to see if the cancer was gone.
Went in for scans, follow-up scans, and amazingly, the scans showed that it was gone. So then I needed to follow up with a full colonoscopy again, just for making certain that it was gone.
That he had a complete response, and that was confirmed when he had the scope that we did not see active tumor on the inside.
Ward is now in surveillance and will continue to meet with Dr. McKean and her team. He says his cancer diagnosis even inspired some of his friends to schedule their own colonoscopy.
I have a lot of friends around my age that had never had one. If anything good came about this, is that it put a little fear into them that, hey, a buddy of ours got this. We could get this. So I had multiple friends that immediately went in to get colonoscopies.
He is thankful for the support he received from family and the Avera Cancer team and encourages others to schedule the potentially life-saving procedure.
The prep is not that bad. So if you're scared of the prep, don't be. You get a nice 45-minute nap, you wake up refreshed, and hopefully you get a little bit of peace of mind when it's over.
We have a very preventable disease. If patients go in and get their screening colonoscopy and have the polyps removed before the cancer is even found, then they don't ever have to meet me in oncology.